I'm going to open up the floor to our first question. Any one of you panelists have a question that you want to bring up? If not, I have some from our listeners I could start with. Just let me know.
What are your thoughts now, and maybe even compared to when you first started in your role, on ABA? What is ABA to a speech community, to a speech therapist? What is it? Because in my experience, there are some misconceptions that kind of vaguely, which I'm sure there's misconceptions about speech from us, like, so I know there are, like, I think things that are probably not true. So what are some of your impressions?
So I do have a unique background. So I actually was waitlisted for grad school initially. So I actually had a family friend who was in ABA. So I actually went through the training to become an RBT. So I had a little bit of knowledge, little bit of understanding. And then I feel like that made a difference when I did get into grad school, because I understood where you were coming from. And I felt as though a lot of the theories that you implement for ABA also roll over into speech too, right? You are reinforcing communication at the end of the day in a speech session. And so I feel like it's very challenging sometimes for speech therapists to understand why an ABA service would be modifying the behavior or needing to step in and kind of redirecting. But that's where you're educated in, whereas we're not. We're educated on repairing those communication breakdowns and helping figure out ways to support that. But I also feel like on the flip side of that, you're also educated on that too. And I've seen that even more since working with Mallory and seeing what they have already implemented. And, I'm sitting there in a session, I'm like, yeah, that's exactly what I would do too. Let's expand on that now, or maybe let's work on that being a little more consistent. So I see it 2 times in a session. Let's try to get it up to 4 or 5. And so I think it now has made me more patient and more willing to give a little extra wait time and know when to push in and just kind of wait and know that this isn't really a communication opportunity. This is more of, we need the behavioral side to step in right now, or my kiddo just needs a minute, not to have all this auditory bombardment.
Right. And I guess I ask, because I've looked a lot into this, and one time I was reading kind of a blog by a speech therapist, and it was like, why speech therapy is the best alternative to ABA. And then it went down to list the 10 most common methods used in speech. 100% of them were ABA. Founded in ABA, researched in ABA, and through the decades had trickled their way into speech because they're extremely effective. And I was sitting here reading this article saying that she's describing exactly what I do 40 hours a week. I mean, not with a client, but in my job, and saying this is an alternative to that. And I'm like, that is that. And so I've seen, and then of course there's 25,000 comments being like, ABA is so much worse than speech. What you're talking about is great. And I'm like, that is ABA. But what do speeches think ABA is then? Where I'm like, you can really write a very profound write-up on these methods that are clearly, they were founded by literal behavior analysts saying this is a better alternative to behavior analysis. And I'm like, what is going on? And then every method I've seen for communication and behavior, of course, like across any discipline, is going to be rooted typically in ABA. They're going to describe it differently, which that's just a semantics issue. There might be words, but the method is straight up ABA. So for me, I've always been confused on like, what do they actually think that we do? Because they're just saying like, do what we do, and the best things that we do is what they do.
Yeah.
We took that kind of from them and their researchers,
And I would even argue too that ABA and OT overlap a lot too, because of the sensory needs. So I feel like it comes down to truly educating yourself on the different disciplines. Like, I personally made it a point to observe. If I had a canceled session, I would take my laptop and sit in a PT session or sit in an OT session. Unfortunately, I didn't really have a ton of ABA services near me or in the same building, so I couldn't do that. But before starting grad school, I had that opportunity to go and observe, and I did. And I feel like that's the difference sometimes between what makes a mediocre therapist and someone who sees the value in that, comprehensive interdisciplinary team. And not saying that, everyone has all the time in the world to go and do that, but even just like you had mentioned, reading an article or looking into it for 5 minutes makes all the difference.
Yeah. Do you feel like that is part of the character traits of a speech therapist? Like, I know in behavior analysis, we're not super popular for looking into other disciplines, educating ourselves in other disciplines. I know that we are guilty of that. Do you feel that speech nowadays, they are much more open-minded to learn more about ABA instead of just thinking that we're sticker charts? Because that's what I get all the time. They're like, he's not speaking, he doesn't need a sticker chart. I'm like, I've never used a sticker chart. I don't know what you're talking about. But like, they clearly are very misinformed. Typically, it seems like they're informed from Facebook, most of the time. So do you feel like that the tone of speech therapists nowadays is more open-minded or more restricted?
I would say, and I would hope that we're becoming more open-minded. I know something that my university was implementing. I went to the University of Toledo for grad school, and when I was there, they implemented the interprofessional education program. So that was once a week where we had to meet with a group of us in the grad program. So pharmacy, social work, occupational therapy, physical therapy, the medical students, the list goes on and on. And so I don't know if maybe more programs are implementing that. There was research found to really boost the interdisciplinary team approach after graduation once universities were implementing that. So I don't know if that's part of us moving forward as a profession and being more open-minded and being more willing to collaborate.
I'd say the same about us. I hope that we're making progress. I think that we can say that that's a hope of ours. It is challenging, and I'm going to say, like, I will verbally say I like to be open-minded. In my actions, am I showing it? I don't know. So it sounds like we're probably in the same boat as fields, as like being like, hey, we should probably be more collaborative and open-minded. Are we doing a good job of it? I don't know. But the intention is there. And hopefully that evolves into something else, something more.
Yeah, I agree with you.
I think that just on the very basic, marrying the two, one of the things that was just for me, pushed me to say, I need to have access to a speech pathologist pretty much whenever I need, right? And not waiting for a phone call back. Because we do know that speech therapy, typically their sessions are shorter and they're back to back to back to back, especially in the school district, right? So Lexi had mentioned it before. We have been able to create something a little bit different. Our sessions are 45 to 60 minutes, twice a week, 2 times a week possibly. And so that makes a big difference. But I think that one of the things that really pushed me was, okay, look, so even at 1 hour a week, let's say our clients are getting outside speech just at 1 hour a week of speech. The other hours of the week, right? They're getting ABA, OT, they're going to school, they're going with their parents, right? And some of the younger ones aren't going to school yet. So I need to be able to look at it as I am giving them all the rest of the hours, the opportunities to practice what they have learned in speech as well. And then if I'm seeing something that I'm like, hey, I think there might be an issue here, then I can immediately reach out to Lexi and say, hey, I'm noticing this. This is what I think my approach is on the behavior side. Does it line up with what you might do on the speech side? And then, that's just the beauty of collaboration, right? And I think one of my other concerns was I did have several clients who were going to speech sessions and they were being ended at 10 to 15 minutes because the child was just so dysregulated, right? So that was where I was like, look, on the behavior side, like we can support the behavior, right? They can implement speech, but we can support the behavior and be able to like help the speech pathologist navigate that a little bit better. Because some of the speech pathologists are very comfortable probably addressing some of those behaviors, maybe even the ones that have more experience, right? After so many years, you're kind of like, oh yeah, I've seen this a lot before. But some of the newer ones don't have necessarily that training. And so for us to be able to have that training and offer it during it, I think that sessions, would be so much more successful and beneficial for the kiddo. And then also, again, too, with supporting the parent, right? So, and supporting my techs too. So there has been multiple times when I've been in a session kind of observing what my tech is doing and then what speech is doing. And I'm like, praise the Lord, because Lexi is saying the same exact thing that I have asked my tech to do multiple times, right? And it's like, it's just one more person, one more professional that's saying like, hey, like, this is important. And I don't feel like just a complete record, player, like playing over and over again. And I think that sometimes her approach is, it's different than mine. I think that sometimes, because, and we've all talked about it, being in this field, it gets tiring sometimes. And so when she can come in and present it maybe in a little bit different way, and then I can continue to give them the opportunities, outside of speech in ABA sessions, I just think all around it'll be so great. Yeah, for parents, continuing to get buy-in, continuing to get that engagement outside of sessions, not just with speech, but also with, ABA, and all of them together will really be, the best for the client.